Here is something worth thinking about before we go any further. What if the thing quietly making you feel worse every year is not the thing your doctor has been treating? What if the brain fog, the tiredness that never really lifts, the stiff joints every morning, the skin flare-ups that keep coming back, what if all of those seemingly unrelated problems actually have a single common thread running underneath all of them? That idea stopped me cold the first time I really sat with it. And once you hear the explanation, you will not be able to unhear it. I am Dr. Matau Jami, a triple board-certified gastroenterologist with more than 20 years of clinical practice. And today I want to walk you through 5 symptoms, 5 things that millions of Americans are living with right now that most people have either written off or been told to stop worrying about. Because taken together, they tell a story that the standard 15-minute doctor's appointment rarely has the time or the framework to tell. Stay through all 5. The last one is the one that changes how you see the entire picture. Now, before we get into the symptoms themselves, there is one thing I need to clear up because there's a lot of confusion around the word inflammation. When most people hear that word, they think of a swollen knee or a red infected cut. That is real inflammation, and it's actually your body doing exactly what it should. The immune system fires up, handles the problem, and then backs off. Clean process, good outcome. But what we're talking about today is something completely different. Chronic low-grade inflammation is when the immune system never fully backs off. It stays switched on at a low level, day after day, month after month, quietly circulating through the bloodstream and touching every organ system along the way. Researchers at Harvard Medical School and the American Geriatric Society now connect this kind of slow-burn immune activity to heart disease, cognitive decline, type 2 diabetes, and autoimmune conditions. And here's the part that surprises most people. It rarely shows up on a routine blood test, which is exactly why it goes undetected for so long, and why so many people are told they're perfectly fine when they very clearly do not feel that way. The first symptom is brain fog, and not the occasional forgetfulness kind. I'm talking about the kind where you're mid-conversation and the word you want simply disappears, where you've read the same paragraph 3 times and it still hasn't landed, where you walk into a kitchen with a clear purpose and stand there genuinely blank, trying to remember what brought you in. A lot of people in their 50s, 60s, and 70s chalk this up to aging and move on, and that's exactly the wrong thing to do. Here's what's actually happening. In 2024, researchers using MRI imaging published a study in Nature Neuroscience showing that chronic systemic inflammation, the slow burn kind, physically damages the brain-blood barrier. Think of that barrier as a security wall your brain depends on to keep harmful substances out. When inflammation weakens it, proteins called cytokines, which are essentially immune alarm signals, leak directly into brain tissue. Your brain detects them and responds the only way it knows, by pulling back, dampening focus, slowing everything down, conserving energy as if the body is under siege. That's brain fog. It's not vague, it's a measurable biological response. And for most people, it traces back to the gut. The gut lining is the largest immune surface in the human body, and when it becomes compromised, chronic immune activation follows. That activation eventually reaches the brain barrier and weakens it, so you end up with 2 damaged barriers instead of 1. This is why people who clean up their gut health so often report that their thinking sharpens along with it. Those 2 systems are far more connected than most people ever realize. The second symptom is fatigue, specifically the kind that a good night's sleep does absolutely nothing for. You know the feeling, 8 hours down and you wake up feeling like you never closed your eyes. You've had your thyroid checked, your iron levels, everything comes back normal. And yet, you're reaching for your 3rd cup of coffee by 10 in the morning just to function. A 2018 review in Frontiers in Neuroendocrinology pulled together the clinical data on this and confirmed something striking. When the immune system is activated, even mildly, even in otherwise healthy people, fatigue follows within hours, every single time. And there's a deeper layer to this that most people never hear about. Chronic brain inflammation activates an enzyme that disrupts how the brain produces serotonin. So you're not just dealing with a tired body, you're dealing with altered brain chemistry. That's why the standard panels miss it completely. No routine blood draw is measuring that. And yet, the person sitting across from the doctor feels it every single day. Fatigue that good sleep can't touch is not a personality trait, it's a signal, and it deserves a real answer. The third symptom is morning joint stiffness, and there's a specific number that matters here: 30 minutes. Most people with this issue describe it the same way. The hands are slow to open when they first wake up. The knees resist going down the stairs. The hips feel stiff and mechanical for the first part of the morning, and then gradually things loosen up. By mid-morning, they've mostly forgotten about it, so they never bring it up at their next appointment. Here's what that loosening up actually reflects. During the night, two inflammatory proteins, TNF-alpha and IL-6, the same proteins found at the center of nearly every chronic inflammatory condition doctors treat, accumulate inside the joint spaces. When you start moving and your morning biology kicks in, those proteins begin to disperse. That's why motion helps. You're not just warming up, you're mechanically clearing an overnight inflammatory buildup from your joints. Rheumatologists, the doctors who specialize in this, use 30 minutes as their clinical dividing line. Under 30 minutes of morning stiffness typically points toward ordinary wear and tear. Over 30 minutes, and the inflammation question has to be asked seriously. Most people never know that distinction exists. Now you do. The fourth symptom is something a lot of people consider a nuisance more than a health concern: persistent skin problems. Adult acne that keeps coming back for no clear reason, rosacea that flares with a glass of wine or a stressful week, a patch of eczema that disappears and reappears in the same spot year after year. The usual route is a topical prescription, some improvement, and then the same problem returning a few months later. The cycle repeats because the treatment is aimed at the surface, but a comprehensive 2018 review in Frontiers in Microbiology established something that genuinely reframes this. The gut microbiome is the primary regulator of skin biology, not locally, from a distance through systemic immune signaling. When the gut barrier is compromised, the immune activation travels. For some people, it shows up in the joints. For others, it reaches the brain. For others, it surfaces in the skin. The skin is not the origin of the problem. It's where the problem becomes visible. That's a very different thing, and it points towards a very different solution. The fifth symptom is the one I saved for last, because it's the one that in my clinical experience most often started everything else. Digestive symptoms you've quietly stopped mentioning. The bloating that arrives like clockwork every afternoon. The bowel habits that have been unpredictable for years without explanation. The low-grade reflux that settles in after dinner, the cramping that comes and goes without ever quite becoming serious enough to address. None of it alarming, all of it normalized over time until it became background noise. In 2016, a landmark review published in The Lancet, co-authored by one of the most respected gastroenterologists in the world, formally challenged the medical consensus that these symptoms are unexplained and mysterious. The research identified specific, measurable disturbances at the gut lining: low-grade inflammation, immune activation, compromised intestinal permeability, microbiome imbalance. These are identifiable, they're not imaginary, and they're not simply a sensitive stomach. For the majority of patients I've described throughout this conversation, the gut was where the inflammation began. The brain fog, the unresolvable fatigue, the morning stiffness, the recurring skin problems, they're downstream. The gut is upstream. And until that source is addressed, everything else tends to keep coming back. So here's where we land. 5 symptoms, one common thread: a chronically activated immune system expressing itself differently through every system it touches. No single symptom on its own tells the whole story. But when 2 or 3 of them are present in the same person at the same time, that's a pattern. And patterns mean something. If you've been told your labs are fine, that it's just stress, that this is what your 60s or 70s feel like, I want you to hold on to what you heard today, because that explanation deserves a second opinion. Your body has been sending signals. Learning to read them is the first step towards actually feeling better. If someone you care about is living with this and doesn't know it, pass this along. Sometimes the most valuable thing you can give a person is a different question to start asking. I'll see you next week.